Hello, Miss W. Hi,
Hi.
I'm Daman. May I have a seat here?
Yes, please.
All right, and do you mind just turning off the TV?
Sure.
So we can, because we're going to be talking, so it's better if the TV's off. So I'm here today to tell you about your newly prescribed medication, the nitroglycerin transdermal patch. Do I have your consent to begin the session?
Yes, of course.
All right. Do you have any previous medications that you're taking?
Just Tylenol?
Oh, okay. Do you have any previous knowledge on nitroglycerin?
No.
Okay, so that's what I'm here today to tell you about. I'm going to be telling you what it does to your body, the side effects, how to put it on, when to put it on, how to dispose of it, and just basically how you're going to be dealing with the nitroglycerin transdermal patch. So, as you know, you have been prescribed this medication by your doctor for the chest pain that you've been experiencing. So, nitroglycerin transdermal patch is going to prevent the chest pain that you're having. What it's going to do to your body is it's going to relax your muscles by increasing the blood and oxygen to your heart, and that in the end is going to prevent that chest pain that you're experiencing. So how you can put it on and when to put it on. So your doctor has prescribed you 0.4 mg once daily. So now what that means is that you're going to be putting that patch on once daily in the morning, and you're going to be putting it on your upper body. And it's a patch that you literally just put onto your body, and it's going to prevent that chest pain. So it's important that you put it on in the morning and then you take it off at nighttime, and not to sleep with the patch on, and instead just dispose of it safely. So how you do that is you simply just peel the patch off your skin, and then you're going to fold it together, and then you're going to dispose of it. So now this patch is waterproof, so you can take a shower with it, and it's okay if any water gets on it. It's waterproof. Now if the patch happens to be like ripping, or like it's like ripped, or it comes off or something like that, do not trim it or try to like adjust it. You can always apply a new patch. Do not trim it or use it again. It's only for one-time use, and it's to put on once daily. Do you have any questions about that? Is everything clear so
Yes,
far?
that's clear.
Okay. All right. So when you put this medication on, there might be side effects. Just like any medication, there are side effects. Sometimes it depends on your body and how you react to it. So some of the side effects you can experience with this patch are dizziness, headache, nausea, vomiting. You might experience those things. So it's important that you don't put the patch on and then like drive or anything like that, because it can cause you to be dizzy. So try to avoid that. So is there any other questions that you have?
That's it. No other questions.
Okay, so now if I ask you, just to be clear, if everything is good, do you know when to put the patch on?
In the morning.
Yeah. And do you know when to dispose of it?
At night?
Yes.
Before I go to sleep.
Yes, very good. And what about some of the side effects that you might experience?
I could experience dizziness, nausea, vomiting, headache.
Yes, yep. So do you know what this medication is prescribed for generally?
Yeah, it's for my chest pain.
Yeah. All right, so that's really good for you to learn about all of the knowledge about the medication. So now there are community resources that you can access. So some of the community resources are your family physician or your pharmacist. So if you have any arising concerns about this medication or whatever it's doing to your body, you can always give them a call. And they can answer any questions you have. Another great tip is to use the internet. If you have a smartphone, if you have access to internet or a laptop, and there's anything that you're not aware of, you can search it up on Google, and there is a lot of tips, and just it enhances your knowledge. I have a handout here for you that's going to tell you everything that I just explained, and all about the nitroglycerin transdermal patch. Other than that, if you have any other questions, you can always access them through the community resources.
Thank you.